The most painful truth on World AIDS Day is this: America is on the verge of repeating the same deadly mistakes that cost an entire generation their lives. And the people sounding the alarm are the same experts who watched friends and lovers and patients fade away long, long before this country ever gave a damn about it. Younger Americans grew up in the age of antiretroviral meds, PrEP and PEP, undetectable viral loads. These are all things that are just part and parcel of normal everyday life for this younger generation. But the people who survived that first wave of AIDS, they're warning that the comfort that you're experiencing, the comfort that we're all experiencing, relative comfort, it's fragile. And Congress is making it more fragile. They're actually putting it at risk. Several members of the Presidential Advisory Council on HIV and AIDS have issued a letter urging the White House and Congress to protect HIV funding. They say proposed budget cuts could wipe out decades of progress and fuel a resurgence of infections across the country. Multiple members also say PACHA hasn't met at all this year, raising questions about whether the administration is even listening to its own experts. I can answer that for you. Their warning is very clear and it's very blunt. The United States still sees more than 30,000 new HIV cases every year. And without continued investment, infections are going to climb and preventable deaths are going to return. They point to the bipartisan Ending the HIV Epidemic Initiative, which contributed to a 12% drop in infections, at least new infections. If fully funded, the program could save up to $100 billion in healthcare costs by the year 2030. But instead, House proposals would slash domestic and global HIV programs and cut more than $1 billion from the CDC and dismantle pieces of the White House, or excuse me, the Ryan White program. The White House brushed off all of these concerns because that's what the White House does. A spokesman said PACHA is a largely symbolic body and accused its members of chasing publicity. He insisted the administration is strengthening HIV prevention and treatment despite the proposed cuts. Babies born with HIV, people in long term relationships, people who don't even know they're exposed, all of them are at risk if testing and treatment start to shrink. When people can't get tested, they remain infected, they remain infectious. When they can't access care, their viral loads raise. And when viral loads go up, communities, whole communities, literally entire communities, are placed in harm's way. Dr. Philip Chan, an HIV physician who helped draft the letter, said HIV doesn't discriminate by race, by gender, by sexuality, or by politics. The virus spreads wherever resources disappear. I want to say that again. The virus spreads wherever resources disappear. This is not about poor Black people. This is not about gay Black men. This is not about rural folk. This is not about city folk. This is about the fact that when we invest, we maintain and constrain the danger. When we invest in the resources and use our resources, we are able to control what was once uncontrollable. But when we don't, the opposite happens. The Ending the HIV Epidemic Plan began under Donald Trump with the goal of cutting new infections by 75% by 2025 and by 90% by the year 2030. Chen warns all those targets are going to collapse without sustained investment. We see what sustained investment looks like. We invest in war, we get lots of war. We invest in billionaires, we make more billionaires. When we invest in public health, we keep the public safe. Let's do what's right, y'all.